I must acknowledge that we did have a dip in the last week where we had a shortage of a supply of vaccines, but I can assure members of the public that this has now changed over the last few days. We are very pleased to inform the public that our vaccine supplies have now stabilized. As we speak to you this morning, we have over 10 million doses of vaccines in our storage, in our fridges. In August alone, we expect to receive by the end of in the month of August, when August ends, we will have received over 20 million doses of vaccines. So the supply of vaccines has stabilized, and for the remainder of the year, we expect to deliver another 21 million doses of vaccines. This means that the vaccination program can be expanded sufficiently to reach more people and can be accelerated to cover more and more of the population. We will give some more details in the coming week. For today, just to give the highlight and to assure members of the public that indeed we are stabilizing over the next August. We're very satisfied that we will not get any instability in terms of the supply of vaccines. So we can assure everybody in that regard. Also, just add that in our last National Coronavirus Council meeting, our Vaccine Ministerial Advisory Committee did make a presentation, and following that discussion, the NCCC, on behalf also of the Interministerial Committee, which did not sit this week, will be sitting next week. After that presentation, it was also approved that within our arsenal, we must also include the Sinovac vaccine, which has been conditionally approved by the South African Health Product Regulatory Authority, but also that the AstraZeneca vaccine, which have now been shown to be effective against the Delta variant that into use. And of course, there is some work which will need to be done in terms of the regulatory aspect of the AstraZeneca vaccine. So I want to take this opportunity to assure South Africans again that these vaccines, which are being approved by our regulatory authority, have been tested and have been found to be safe and effective, especially against serious illness. We want to emphasize again that there is no claim by any scientist, any one of us in the health leadership, that once you have the vaccine, you will never get COVID-19 infection. What we are assuring the public is that, and it's proven, not only in South Africa, but all over the world, that people who are vaccinated, in 99% of the time, they will get, even if they get the virus, they will get a mild disease. If they do end up in hospital, in most cases, they will not end up in ICU getting serious illness. So these are the things which have been tried and tested over the last 8 months or so all over the world and also in our country.